I'm a rehabilitation psychologist, and so my roles here at the University of Michigan are as a clinician, a researcher, and an advocate. As a clinician, I work with individuals with generally physical disabilities and their family members. As a researcher, I'm working across disability, and once again, the focus is on health management. And I also see myself as an advocate in terms of ensuring that the voices and the issues of folks with spinal cord injury and other disabilities are heard. I'm the director of the University of Michigan Rehabilitation Engineering and Research Center, which is focused on using mobile technologies to support transition to adulthood and independence for adolescents and young adults with disabilities. I have one project funded by the Department of Defense in which we're trying to identify strengths of individuals who have been living with spinal cord injury. Another project is we received funding from the Craig Nielsen Foundation to create an interactive e-learning course for folks or healthcare providers in order to facilitate the integration of self-management and self-management of spinal cord injury. My key focus is the idea of self-management and thinking about what skills do people need to manage their health in the context of their lives. It's an evidence-based type of program, but it's also a philosophy. People have different priorities at different times, and our motivation to change or do something very much depends on the context. So involving them, giving them the knowledge, the skills to be able to make the best choices in their lives with contexts that we may not be aware of. I think it comes down to how do we set up clinical interactions so they're feasible. So it's not just one person who's trying to do everything in a reduced amount of time in order to get a small amount of payment. The idea of building levels, tiered systems and approaches that we've already begun to do with regard to having nurses, physicians' assistants, other allied health disciplines doing some of the training, doing some of the education, having digital medicine as part of our assessments and the tailoring of interventions so that it can be appropriate. IHPI offers that opportunity for collaboration. It offers an infrastructure and the connections that we need not only to do our research, but to get it out there and to connect with one another. A lot of times I don't know the first place to start when it comes to connecting with news media or with politicians or really taking the next step about translating the work we do to influence policy or practice. And so it's really exciting to be part of the Institute for that reason. We have to turn healthcare on its head. You know, this is both a challenging and exciting time as the pressures of the system force us not just to do more with less, but to make new pathways, to think of new ways of doing things, to consider new systems, new policies, new innovations, and how do these fit together? I think it's really exciting to be at a place where we're part of the solution. I don't have to have expertise in everything, but I should be aware of some of what's going on, and IHPI helps that process, and it helps us link the pieces in a way that hopefully will work to better health.